Welcome, and thank you for joining this exploration of Alzheimer's disease, where we'll unpack the science, current challenges, and what lies ahead. In this presentation, I'll guide you through the biology, early detection, and practical strategies to slow progression, setting the stage for a clearer understanding of why Alzheimer's demands urgent attention and coordinated action. This page highlights the global burden of dementia and why it matters now. Over 55 million people live with dementia worldwide, and the economic toll already tops $1 trillion annually, set to double in the coming decade. The slide emphasizes rising incidence with age, disproportionate impact on women, and the urgent policy and funding drivers pushing research forward. The schematic here shows how beta amyloid pathology begins long before symptoms appear. Misfolded amyloid peptides aggregate into plaques that disrupt synaptic signaling and ignite inflammatory cascades, gradually eroding neural circuits over decades. The key takeaway is that accumulation is a slow, upstream process that sets off downstream damage, well before clinical memory loss becomes obvious. This slide traces the tau protein cascade from microscopic tangles to clinical dementia. Hyperphosphorylated tau detaches from microtubules, forms intracellular neurofibrillary tangles, collapses neuronal transport, and then spreads anatomically from the entorhinal cortex into the neocortex. Clinically, this progression maps to a shift from mild forgetfulness toward profound cognitive decline as circuits deteriorate. Neuroinflammation is framed here as a self-perpetuating cycle involving microglia and astrocytes that release cytokines and reactive oxygen species. Chronic inflammation further activates glial cells, amplifies neuronal damage, and perpetuates amyloid and tau pathology, creating a vicious loop. The slide also points to a therapeutic shift toward immune-modulating approaches aimed at interrupting this damaging cycle. This slide contrasts normal age-related forgetfulness with Alzheimer's red flags and stresses the importance of early clinical evaluation. Occasional misplacing or slower recall is common with age, but persistent, worsening deficits that interfere with daily life, repetition, losing items in illogical places, or inability to recall recent information, should prompt timely medical assessment and support planning. Language and visuospatial problems often surface early and deserve attention as warning signs. People may struggle to find words, lose their way on familiar routes, or have difficulty following conversations, reflecting progressive cortical damage. These patterns are important cues that should trigger a comprehensive neuropsychological assessment to clarify diagnosis and guide early intervention. The biomarkers page shows how CSF assays, scalable plasma tests, and PET imaging together enable objective early detection. CSF changes can appear decades before symptoms. Plasma tests broaden screening capability, and PET offers in vivo visualization of amyloid or tau. Together, these tools support earlier diagnosis, enrollment in preventive trials, and more personalized care planning. Diagnosing Alzheimer's requires structured cognitive testing, plus exclusionary labs and imaging to rule out other causes. Standard tools like MMSE and MoCA quantify memory, attention, and executive function, while blood panels and MRI check for thyroid problems, vitamin deficiencies, depression, or vascular injury. The overall goal is accurate differentiation, so appropriate treatment and timely intervention can follow. The treatment landscape is evolving from symptomatic relief to strategies aimed at slowing disease biology. Current symptomatic agents provide modest benefit, but do not change long-term progression, while amyloid-targeting antibodies can reduce plaques and modestly slow decline in early disease. Ongoing combination trials aim to target amyloid, tau, and inflammation, together with the goal of clinically meaningful, long-term preservation. This slide focuses on proactive, evidence-based habits that build resilience against cognitive decline. Regular aerobic exercise, Mediterranean-style nutrition, cognitive training, adequate restorative sleep, and sustained social engagement all support neuroplasticity and vascular health. Collectively, these lifestyle measures can reduce risk and strengthen brain reserve, empowering individuals to adopt practical steps that complement medical care. Looking ahead, the presentation outlines a hopeful, technology-driven future where Alzheimer's becomes a manageable chronic condition. Advances in gene editing, ultrasound-enhanced drug delivery across the blood-brain barrier, digital biomarkers for continuous monitoring, international data sharing, and personalized prevention strategies are converging to enable earlier, more precise interventions and tailored risk reduction for patients.